Brian was every parent's dream. Always smiling. Brian became addicted to alcohol and pot over a period of months, but then he was legally prescribed Xanax, and that put him off on a whole different trail. He went to 8 different treatment programs over the next 8 years, but when he got out, he always relapsed fairly quickly. He was told by the outpatient program that he no longer needed to be there. And the next morning, he woke up and took his own life. After my son passed away, when I was able to step back and really try to understand what had happened, and I found out that there was all this research sitting in peer-reviewed medical journals that's already been funded by NIH research over the last 2 decades that neither I as a parent or the treatment programs that treated my son were aware of or were using. I'm reading about programs, research, that could have saved my son's life and hundreds of thousands of others just like my son.
This epidemic is a national health emergency.
Today, the president is talking about the opioid crisis. Everybody's panicking, and they're right. This is a terrible thing. You know what my PhD dissertation was in 1982? It was methadone physical dependence and pharmacokinetics. Methadone physical dependence, that is methadone addiction. That's 1982.
If HARPA existed today, I would instantly develop the technology to understand the prescribing practices of every single doctor in this country who prescribes opioids, and to be able to report on that on a quarterly basis with only a 30-day lag, so we can immediately spot which prescribers in this country were prescribing outside of CDC guidelines. The cost to our society of the opiate epidemic is enormous. $200 billion to $500 billion, depending on how you count it, every single year. And you have a solution that would cost way less than $50 million a year. The multiple on that is enormous of what it would save, let alone the human suffering.